The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, 6-month braces. A new technique that allows people that maybe can't afford veneers, porcelain veneers, or even Invisalign, now have an option for adults, and it's called 6-month smiles. With us, we have an expert on the topic. He's been through the training, Dr. Desai. Dr. Desai, welcome to the program.
Nice to meet you.
All right, now before we get into today's topic, tell me a little bit about your practice. You're in Glendora, California.
That's true.
So who's a typical patient?
Well, I have a small, beautiful practice located in the city of Glendora where we see patients as small as 6 months old who just got their first teeth in to, I just made a dentures for an old lady who was 90. And
so dentures for a 90-year-old?
Yes, and they were really happy with the results. And that's what she wanted, that's what she got. So I get...
So you do just about everything. I mean, you make dentures, what else?
Everything from veneers for bank managers to whitening for housewives to fixing teeth for construction workers or a broken tooth which needs to be taken out, and we accomplish that pretty good with our patients.
Now you have and I looked at your ad, and you told me, I said, describe your practice. You know, we're talking on the phone about the 6-month smiles. If you're just tuning in, we're talking about orthodontics for adults. It's a brand new 6-month smiles to straighten your teeth. It's about 80-90% less than veneers. Definitely. Is that right?
That's
it's even
correct.
less than Invisalign, and
That's
it works.
correct. That's correct, and
Okay.
it gives good results.
But you said that you have kind of like the old-fashioned, homey dental office. Tell me about that. And I'm paraphrasing that.
Well, we believe in giving treatment what patient needs. We don't overdiagnose or we don't
Overdiagnose. What do you mean by that?
Like
selling something.
Selling stuff.
Okay,
Where there are a lot of people who come in saying, oh, I came from this dentist and I was advised to get 10 veneers done. But that same thing can be accomplished just by doing 6-month smile and some bonding, some whitening in the end. And it's almost like 80% less expensive to the patient. So patients really love it. Patients are comfortable with what we do, and we want to provide them a compassionate as well as friendly dental office where they think that they are taken good care of. At the same time, they get the best treatment out there in the market.
So 6-month braces. And you say sometimes that they could even be less than 6 months to straighten the teeth.
Yes. Well, basically, it depends on what type of case we are doing. If the patient likes the final result, we can take them off as quick as 4 to 5 months. Generally, the 6 months is the average time. It can range from somewhere from 4 to 9 months.
Okay. Now, you know, we had this discussion, and very interesting. In a tough economy, people are spending money on themselves to look better, more presentable on job interviews. Elaborate on that. Expand on that.
Well,
is that what you're finding?
Yes, that's what we are finding. People want to look better, and looking better, the smile is in the center of their face. So that gives them self-esteem, self-confidence when they're going for a job interview or when they're making a sales pitch. And this is something which can be accomplished in as soon as 6 months. It's not like before your next cleaning, your teeth can be as white and as beautiful as you wish for.
Yeah. Now, you know, to me, I told you, I like veneers. Okay. It seems fast and easy, but you know, in tighter times, I guess.
Well, veneers are a good option for somebody who money is not a problem for them and who wants a quick fix, who don't want to wait for 6 months. So veneers have its own place. It's not like we are trying to replace veneers or we are trying to say that no, we shouldn't do veneers at all. Yes, veneers are a good thing, but this is something. This 6-month smile braces option is for somebody who had braces done before, who doesn't want to go for a traditional braces again for 2 or 3 years.
So they had braces and their teeth
shifted. They didn't wear the retainers. Their wisdom teeth came out.
That seems to happen to everybody, by the way. Your bottom teeth.
Bottom teeth moves.
And why is that? I don't want to get off topic here. But
yeah,
why?
well, the wisdom teeth, generally when you're a kid, you get your braces you're done with your braces by the time you're 16. The wisdom teeth starts to come from 17 to 25. And a lot of times kids go to college, they don't want to wear the retainers. They go out party and they forget to get their retainers in.
Yeah, you don't party with your retainers.
So a lot of times the damage happens between that time when the wisdom teeth are coming in, when they're not at home, they're living in the dorm, nobody's there to look at them, nobody's there to keep an eye on them, to remind them of that thing. So most of the damage happens during that time. And by the time they go out for a job interview, they realize their teeth are not as perfect as they were before. So this is a perfect option for them. Before,
How is it different than traditional orthodontics? Because you say it's a big difference.
yes, definitely. With traditional orthodontics, it's for correcting the whole smile, whole bite changes, everything, jaw surgeries, things like that. With 6-month smile, we just concentrate on front 6 to 8 smiling teeth.
So just the ones that are showing.
Ones that are showing, and
Okay.
we move them into the correct position using clear wires, clear braces, which are custom made just to fit your teeth.
So what would an orthodontist say about this? They may say, hey, this guy, Dr. Desai, is not an orthodontist.
Yes, and after going through this course, I really appreciate what orthodontist does for most of our patients.
Okay.
We really like how they change the bite of the patients, how they make the bite more functional, how they can work with the oral surgeon doing jaw surgeries and putting a perfect bite. 6 months braces is not for those people. 6 months braces
So it's more of just
cosmetic thing,
straightening teeth.
straightening teeth, more for people who don't want to go for traditional 2 or 3 year braces treatment. It is for people who just have perfect bite, but just have few crooked teeth in the front, which they need to be corrected, and they have never given that option whole their life. Or the people who already had braces, like we talked about, but their teeth became crooked over a period of few years while they are not wearing the retainer.
What are the age ranges of the people with the 6-month orthodontics?
Generally, we recommend anybody over 25.
Okay.
Anybody over 25.
What are you experiencing? I mean, what age range?
Generally about 25 to my oldest patient I'm working on right now is about 65 years old.
65.
Yes.
Male or female?
Female.
Now, do men put things off like this?
Yes.
It's mostly women that are doing
Mostly women that are more interested in getting their smile fixed. And nowadays we have seen that with this recession, looks have become more important.
this? Really? You think so?
Yes. People are coming in, even though money is tight, people are spending money on themselves a lot for them to look more better, more functional, and that gives them a boost on their self-esteem, their confidence, and helps them get a better job or gets them promotion.
Well, there's no doubt about it. I mean, the person that is smiling, a smile's attractive.
Yes.
Even if the teeth are a little bit crooked. But I guess if you don't like your smile, you're not going to smile.
You're not going to smile. You're going to look at the pictures. There are some people out there who, if they look at their pictures, they never had a smiling picture all their life.
Have they told you that before?
Yes, and a lot of times what happens is if they're talking to somebody, they always have a hand over their mouth. They never want to smile or they never want their teeth to be shown.
Now, I know somebody. I have somebody that works in this office. Her teeth are beautiful. Beautiful smile. A little bit crooked on the bottom. She thinks everybody's staring at her. And I said, nobody's staring at your bottom teeth, right?
That's true.
But, I guess the point is, if it bothers you...
If it bothers you, come to us, come to me, and I'll be more than happy to help you fix that. And it might be as short as 4 months.
I mean, 6 months is going to happen whether you like it or not anyway. You're going to...
Yes, time's going to fly through, to be honest. A lot of my patients come back and tell me, oh, really, it's time to take them off?
I tell her, because I interview dentists from all over the country. And I told her, and it's Carolina, and I said, you should do veneers, perfectly straight teeth at the bottom, just at the top. What is your argument to that?
Well, veneers, the only argument,
because you haven't seen her teeth yet, but they're perfect.
The only disadvantage of veneers I can think of is to shave some part of enamel out and to make your teeth look perfect, to remove that crooked part of your tooth which is bothering you, to make it look perfect. With 6-month smiles, we don't have to shave any part of teeth.
You have to shave the teeth, is what you're saying.
With veneers, you have to.
Right.
With 6-month smiles, you don't have to. Basically, we move the teeth using clear wires, clear braces.
And these don't look like your regular...
No, they don't
braces.
look like...
I think it's a young look. When I see a woman in her 40s and she has braces, I think it makes her look in her 30s.
And she wants to to look like she was in her 20s. And that's what we accomplished by doing that.
So they're clear. I mean, what about rubber bands?
The rubber bands are clear too. See, look at them. They are really clear. They're tiny rubber bands.
I came and see this, but yeah.
And we have clear wires to go along with it.
Let me see this.
All right.
Oh, this is a wire?
It's a nickel titanium clear wire, which helps us to move the teeth into correct position. And
if you had to say this is better than Invisalign, Because I know secretly you think it's better than Invisalign.
It is 100% more better. I would
Now, this is your opinion, because I don't want to have to put a bunch of disclaimers all over the bottom.
No, this is my opinion.
Okay,
and once I do this treatment, my patients really think.
But why is it better though, Invisalign?
Well, with Invisalign, nothing to take away from it. There are thousands of cases. It works, and people have got good result with it. But the compliance is a big issue.
Compliance.
Yes, you have to wear it for 23 hours a day. I don't think we have a lot of adult people out there who are ready to wear it 23 hours a day. They can wear it during weekdays, but weekends.
Well, every time you eat, I mean, most people eat 3 times a day.
They take it out
6 times a day.
They take it out during lunch and forget to wear it, put it back on, or they're going out.
You have to brush your teeth before you put it back on.
They go to dinner with their friends.
And I'm not trying to side with you here, by the way. People tuning in, this is a real interview. Nobody's scripted. But the fact of the matter is that Invisalign you have to wear 23 hours a day. And it's longer. It takes longer.
It takes about to get a good result, it takes minimum of 9 to 12 months. To get a great result, it takes up to 18 to 24 months. With 6 months smile, we have more control of how we move the teeth. Patient is not in the control. The dentist.
Can you do more things with 6-month braces than you can with Invisalign?
Yes, we can.
Like what?
Like moving teeth, moving them into correct position, tilting teeth. With the Invisalign, they have to put some attachments to accomplish that, not just a trace. And if you're going through that route, why don't just wear clear braces for 6 months and get a great smile?
Is that right? And people, now the patients you have, they're happy.
They're really happy. They're really excited. They love it. And when we take off their braces, a couple of patients have just got up and gave me a big hug. And at the end of 6 months, I know they went through the trouble of wearing the braces, flossing through it and everything, but just getting a hug at the end, wow.
I laugh at that. So the patients, when they see their smile, you take them out, then they hug you.
Yes. Before they go for their final pictures, they really appreciate what they got.
Now when they see their bill, then they don't hug you. Is that right?
Actually, it's less costly than Invisalign and veneers. And they are really surprised.
So it's less than veneers and Invisalign and orthodontics.
And traditional braces, yes.
A lot of people out there with crooked teeth, okay? Especially in Glendora. No, I'm kidding. But do you think the big thing is they just, when they think of orthodontists, they think of bulky, it shows?
A lot of people are never informed about this kind of procedure out there, which can give them great teeth, great smile in the end, and in as last as 6 months. A lot of times when they think about smile makeovers, they think about expensive procedures. They think about veneers, which are going to cost them $10,000, $20,000. They think about full mouth makeovers, which is going to cost them $50,000. This is an option for those people who don't want to spend that much money, who can get their smile really great, just with 6 months smile, a little bonding in the end, a little whitening, and a little gum contouring with a laser, and they are off they go.
After the races.
Yes.
As they say. They're ready to go, they're smiling, they're happy. And then they have to wear a retainer afterwards.
Yes, we do provide them with a fixed retainer which goes on the inside of your teeth.
And that's included in the price you told me?
That's everything included in the price.
I'm trying not to endorse you here, by the way. But it's hard not to, right?
I understand that. And for a lot of people, they will think it's too good to believe, and I would encourage them to come to my office, visit.
But you can move teeth. I mean, can the teeth be pretty crooked?
Pretty crooked, and they can be moved into place. And like I said, and the average time is of 6 months. Sometimes if the patient wants some teeth to be moved a little bit more, it can take up to 9 months.
But it could be a little bit less as well.
As less as 4 months.
And you do whitening and things like that?
Whitening, laser recontouring of the teeth, laser recontouring of the gums after we are done with the braces.
6-month braces. Okay, good. We're going to take a quick break.
Okay.
And we come back, and we're going to take me through the process. What they can expect on day one. You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about 6-month braces. This is an alternative, and this is for adults. It's an orthodontic treatment that only takes care of the teeth that are showing, and it's a lot less than veneers, and it's less than Invisalign in most cases, or every case.
Every case.
Okay, and you say it's easier than Invisalign.
Yes.
Because Invisalign is good.
Invisalign is great for people.
But you like this a little bit.
I like this because, like we discussed before, the teeth movement are more predictable, and patients get
more predictable.
Yes, more predictable.
Okay, we're going to take a quick break. We come back, more about the process, maybe some before and after photos. And you're watching the Wellness Hour, leader in medical news and information. We'll be right back. You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, 6-month orthodontics, or as Dr. Desai calls it, 6-month smiles. It is a alternative for people that, as Dr. Desai says, they have crooked teeth, they can't afford veneers, maybe they can't even afford Invisalign. This is less, and it works, according to Dr. Desai.
Yes, it works
great.
Is
that right?
Yes.
I didn't exaggerate about anything there, right?
No, Randy, you're perfectly on topic and you're on the spot. Actually, I have one patient to show it to you whose braces we just took off recently. If you look at his upper teeth, right here, his front 2 teeth are a little bit crooked. They're going a little bit inside, and he didn't like that growing up. He hated all his life. And
is that what he tells you?
He works in a bank, a good bank, and he didn't want to smile. And customer relationship is really good, really the first thing in the banking industry right now.
Okay.
And he wanted it fixed. He came to us, and look at this.
Good.
In 5 months, his front 2 teeth are right there where they are supposed to.
Very nice. So he lived with this his whole life.
His whole life.
So the front 2 teeth were just pushed back.
Pushed back a little bit, and he wanted that to be taken out a little bit. And he had options for veneers, and he had options.
How did he hear about this?
Well,
just came in as a regular.
Just came in as a regular patient, and we did a consultation with him. We gave him different options for Invisalign, for veneers, and things like that. But he wanted to go the most conservative way, and that is 6-month smile. And if you look at the pictures, there is no cosmetic dentistry, means no bondings, no veneers, nothing like that. It's just straight.
And now he has the best smile of all the tellers.
And he loves it. And he's hoping that will help him further his career and get him a promotion.
So everything is included. I mean, you know, the one price includes the aftercare,
before,
things like that.
after pictures, braces, the 6-month bra, custom braces, as well as the retainers, which they get finally. And these retainers are bonded retainers, which are bonded to the back of your teeth, and they really love it.
Now, this is probably an obvious question, okay? But if somebody comes in and they go, you know, Dr. Desai, I need, 6 veneers on the top and 5 veneers on the bottom or whatever, but you know for sure that they would be better off here.
Basically, when a patient walks in for a consultation for any cosmetic dentistry procedure, we go over all the options with the patient, ranging from...
But do you push what you think is best for them?
We push them towards 6-month smile if that can be achieved and that can give them good result, what they are expecting in the end.
Okay.
But we leave that decision for the patients because...
Are they surprised that you're pushing the less expensive procedure?
A lot of times they do. And we our motto for our practice is just to try to give them the best we can, not overdo things. And even though it's less beneficial for us, if the patients are happy in the end, it works out great for them.
Works out good. Okay. Now, you said, so you got into dentistry, and young guy, and you said you were surprised at how gratifying it is to help somebody with their teeth.
Yes, a couple of...
Elaborate on that.
Well, let's talk about a patient whose braces we took off recently. And she's a 60-year-old patient, and all her life she was going to a dentist religiously, regularly, but she was never presented with the option of improving her smile. She came to us for a consultation. We did 6-month smiles, and in 5 months, her teeth had changed so much that she was like, I wish I would have done this when I was younger, or I wish I had this option when I was 40, and I would have a great smile for the last 20 years. She got up from the chair, she gave me a big hug, there were tears in her eyes, and wow. After a couple of minutes, it hit me that, wow, I changed her life forever now.
Interesting. And you feel like that. Do you ever go home, I know you're married, you go home and you tell your wife, oh, I had a good day.
Yes, and good day not from the financial point of view, good day not from the business point of view, but good day from compassionate way of life.
Makes you feel good.
Yeah, we feel good. Patients, they appreciate what we do, and they want to come back to us. It makes them come back to us every 6 months or every 3 months, depending on their needs.
Okay, now as a recap for people just tuning in. Okay, so 6-month orthodontics, I'm calling it that, 6-month smiles. This is not to replace what an orthodontist
It is
does.
never to replace what an orthodontist does. Actually, we appreciate what our orthodontist does for us. And this is typically for patients who don't want to go for traditional braces, who don't want to go for $20,000-$30,000 veneer cases. This is for somebody who wants the smile to look much more better, much more prettier, and it can be done in as short as 6 months.
Now, with the 6-month smile, 6-month braces, you say you do a combination. I'm going to say you do a combination of procedures.
Yes.
What do you mean by that?
Once the teeth are aligned in the correct position, once the patients are happy and I'm happy with that position, we do some recontouring of the teeth, we do some bonding to make them look much more prettier, as well as the laser recontouring of the gums to give them a nice, perfect looking, healthy smile without spending $20,000-$30,000.
Is this painful?
Not
Do they
least.
complain about pain?
Not a list.
Because I have an 18-year-old son with braces, and it's
Actually, it's very comfortable. Yeah, it might feel a little funny with the first few.
Is it less tight than traditional braces?
It is less painful and less tightening than the traditional braces because the wires which we used are very thin wires.
They're
so
thin,
the
okay.
so the forces we apply to the teeth are not that great. A lot of times patients ask us, how can you move teeth in such a short time without causing any root resorption or without causing any pain? And my answer to that is we are just tipping teeth into the correct position. We are not physically moving them from one place to another.
So you're just
Tipping them to make them
tipping them.
Yes, tipping the crowns of the tooth to make them look much more acceptable.
Aesthetic. Now, dentists will watch this show. Okay, they don't like to admit it, but they're going to watch the show, right? Okay.
Yes.
What do you want them to know about 6-month braces?
Well, it's a great
Because you
alternative.
might get some referrals.
It is a great alternative to veneers as well as Invisalign, and it's a great alternative for patients who have wanted perfect, beautiful smile all their life, who are never able to get it either because of the financial constraints or because they were not aware of it. So please
Okay.
send us referrals, and we would like to see those patients in and help them out.
Now, there are people, I've interviewed a lot of different doctors, but there's a lot of people that I find out, because I'm, anticipating and preparing for these interviews. There's a lot of people that have hated their smile their whole life.
Yes.
And they don't like going to the dentist. They hate dentists.
Well, once you
Because you seem like a nice guy.
Yes.
Are they afraid of you? Still?
well,
Do they tell you?
they've done like a consensus, and we are the second most hated professional after lawyers. That's a
Really?
myth out there.
Lawyers and dentists.
We are next to lawyers somehow.
Really?
And
And car salesmen have got to be on there too, right?
well, they are down the list, but we are the second most out there, and
Do
that's
they tell you that? They still tell you because you look like such a.
they come and tell me they come and tell me I hate dentists and don't take it personally, and we never take it personally.
I hear dentists say that, but do they really tell
They
you
come
that?
and tell us that, and to be honest, once they had a personal experience with us, they go out and tell them no. They take us out of that list. They have a good experience at our office. They have a pleasant staff who greets them.
You don't look like a dentist, by the way, to me. And I meet a lot of dentists.
Uh-huh.
You don't even act like a dentist.
Well, thank you. And I would like my patients to come and meet me there, and potential new patients who want consultation for their 6-month smile are more than welcome to come and visit us at our
Because I have a
office.
lot of people. I'm always telling people to get porcelain veneers and things like that, but I don't know now. Especially, but their excuse is money, 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 money. There's no excuse now.
With 6-month smile, there is no excuse now. If you're good insurance will cover part
If you
of
don't
it.
like your smile,
You don't like your smile.
something about it.
You want to improve your self-esteem. You want to improve your confidence. You want to maybe get a promotion at your job. This is the thing to do. Come and visit us.
straight teeth. that is a very good look. That's a sexy look. When a guy, if a woman has beautiful teeth,
And to be honest, women out there are
and-
spending $300, $400, $500 on their dresses, which they're going to just wear it once or maybe twice. With smile, it's going to stay there for the rest of your life, 30, 40, 50 years. So think about the investment. It's not that much of an investment, and it's just for your own personal thing.
6-month braces. Now, how do people hear about it now? You do some print advertising.
We do
about
print
6 months?
advertisement. They can go to our website, which is GlendoraFamilyDentistry.com. There's a lot of information on there. Or they can come for a free consultation. There is absolutely no catch, no charge for a consultation. You come
No
to
fee?
no fee for
What about
consultation.
hidden fees?
There are no hidden fees. There's a flat fee for the treatment. It includes the pictures. It includes custom braces for you. It includes the final retainers as well. If you need any additional procedures later on, if you're happy with your result and you want to change your metal fillings to white ones, or you want some...
So you do general dentistry.
Yes.
I mean, you do cleanings and
we are a cosmetic, implant, laser, as well as a preventive dentistry office. We see kids, we do sealants for them, we do fluoride treatments for them, we do whitening for moms, we do veneers for bank managers.
So people are afraid of the dentist. They haven't been to the dentist in 10 years, 5 years.
I would encourage them.
I
would encourage them to visit our office, come for a free consultation. The consultation doesn't cost anything, and I bet you they're gonna like it, what they're gonna listen from us, and they're gonna go home happy.
You know, I put this on my Facebook page. I met a dentist in the airport, 83 years old, and I told him a little bit about what I'm doing, and he said, let me tell you, he said, life is too long to not have a smile that you're proud of.
That's true.
That's what he said.
And I really agree with him.
That?
And if you go out and look at any of the front covers of any of the fashion magazines, Vogue, or you can look at E or anything, you will always see nice, perfect, smiling teeth on that. If you take those out and put a tooth that is, put a smile which has a couple of teeth that are missing, or put a crooked teeth, put a ugly looking teeth, do you think they'll be on the front cover? No.
We are out of time. This is good stuff, by the way. And I appreciate your enthusiasm about this. Somebody watching this, 6-month braces, final message to them.
Well, if you're an adult out there who don't like your teeth, who want a nice smile, who wants good teeth but don't want to go for full braces, who don't want to wear Invisalign because the trays are too cumbersome for you, who wants nice, pretty teeth, come to me. I will make your smile look pretty. I will make sure...
Drive to Glendora and get it done.
Drive to Glendora,
nice.
Come to us, and I will give you a healthy, perfect, pretty smile. And that's my guarantee. And
all right. Okay, good for you.
Thank you.
I want to thank you so much for coming on the show.
Nice meeting you, Randy. Thank you very much.
All right. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to watch this interview again, you can go to our website at wellnesshour.com. Just put in orthodontics or 6-month smile or Dr. Desai. And of course, we're always looking for guests to be on the show, so you can contact me directly. Follow us on Facebook. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.